Fertility preservation means when we operate or do surgery and we still keep the reproductive organs intact, such that the patient, the woman who is treated, can still bear children. They can still have, their fertility is still intact. It's quite challenging when we have gynecological cancer patients, because cancer is one thing which spreads and can progress and can involve the whole of the pelvis sometimes. But we can still preserve fertility in early cancers, in some types of cancers of the some types of gynecological cancers. And it's different because although we are preserving the fertility, such as, for example, if you have ovarian cancer, if it's early and you're young and you want to have fertility, we can still leave the other ovary behind and the uterus, provided this is early cancer, and you can still bear children. Obviously, it is slightly different than benign disease, where if we leave all this, there is no danger. There's sometimes small danger that there might be microscopic disease spread to these organs already, and therefore follow-up is really necessary. Intense follow-up after surgery, after treatment is important to ensure the cancer doesn't come back. Also, in cervical cancer, we have to preserve fertility. Sometimes we keep the uterus but remove the cervix, and people get pregnant, and a lot of them have conceived after surgery. It is important that these follow-ups after surgery are kept to ensure that the cancer does not come back, and overall the fertility outcome is good. A lot has happened in the last 2 decades about when fertility preservation comes into place. Previously, especially for cancer, we used to do radical surgery, remove everything, and patients wouldn't get pregnant. But now treatment is available where we can preserve fertility in selected cases. In cervical cancer, we have a procedure called trachelectomy, radical trachelectomy, where we just remove the cervix, keep the uterus. People can still get pregnant. We have now almost over 2 decades of data to show that it is safe to do this, and there is about a very good chance of people getting pregnant after this. In ovarian tumors, such as borderline ovarian tumors, sometimes we will preserve the ovary and the uterus so that the patient can get pregnant. A lot of women do get pregnant. They do not have a recurrence of cancer, and this has changed over the years. In case of endometrial, which is the uterine or womb cancers, we have also medical treatment available where we can preserve the fertility in early stage cancer. Outcomes of this have been good overall, and we try and work with the assisted conception unit, the fertility specialist, after surgery, after any type of treatment, to ensure that you can get pregnant. There is also developing role of cryopreservation, where we sometimes remove an organ and we can still preserve it and introduce it later in the body when you want to get pregnant. There is also assisted conception techniques where your eggs can be stimulated, especially if this is not cancerous condition we are treating, and we can preserve the eggs and all the embryos for future use. So these are the advances which have happened over the years, allowing a lot of women to get pregnant despite having gynecological problems or even cancer of the gynecological organs. The fertility preservation, the length of it, the time taken for this depends on the treatment. Obviously, when we do surgery, we do the surgery and then we give about 2 months, up to 2 months for recovery. And then you can start to try and conceive. How long a patient or couple wants to conceive is dependent on them. The advice given for cancer patients is that they try and bring their plans for having a family forward and try and conceive as soon as possible. Sometimes we will even discuss surgery where we remove the uterus and the other organs, as we would do in radical surgery after they have completed their family. So it is variable how much time. In my practice, it's been quite variable how much time the couple would leave to have their fertility. Obviously, nowadays people do want to delay their fertility as far as they are having their follow-ups regularly. There is not much danger, but I advise is to have their fertility as soon as possible. Have their fertility completed as soon as possible. Also, if the surgery has been done, or chemotherapy has been taken, sometimes women will have chemotherapy after surgery, and that might hamper the fertility to some extent. We will work with the fertility specialist to enhance your chances of fertility. And how long it takes will depend on how successful we are in getting you pregnant. After treatment, which gives you fertility preservation for cancer treatment, it depends on what treatment you had. If you had the cervical cancer treatment, where there's fertility preservation, if this is just removal of the cervix by a small procedure called LLETZ, which is for very early cancers, then there is no change in what we have to do except follow-ups. Follow-up first time after 6 months of treatment, and then 3 monthly thereon for the first year, and then 4 to 6 months in the second year, and then yearly for up to 5 to 10 years. If obviously we remove the cervix and the whole of the cervix in the part of your treatment, about 65 to 70% women will get pregnant. They will carry their pregnancy almost up to term, but about 25% women will have preterm labor. They may rupture their membranes, and the delivery is by cesarean section. This is because the neck of your uterus, which is the new opening of the uterus, is closed with a stitch, which is to retain the pregnancy inside when you are getting pregnant. If you have surgery for ovarian cancer, especially borderline ovarian cancer, there is no change in what happens to you during life. Your other ovary will still work and produce eggs, and you can get pregnant. Your follow-ups will continue for almost at least 10 years, because rarely the borderline ovarian tumors can recur quite late. If you're receiving medical treatment for womb cancer, where the womb has been preserved, we will wait for 2 biopsies to be negative after treatment with with hormones. And if these are negative, then you can try and get pregnant, and we advise to go to fertility specialists to help you get pregnant. If the treatment is chemotherapy, rarely we will find that you need chemotherapy after or more surgery after fertility preserving surgery. That would hamper your future plans for conceiving, because the completion surgery may involve removal of all the reproductive organs, and the chemotherapy might hamper the functioning of the ovaries, and you can get premature menopause. Therefore, in these cases, we always work with our fertility specialists, and we refer you before surgery, before the fertility preserving surgery, to have a complete discussion in case we can, in some cases, preserve your eggs and embryos.